give just a moment for everyone to join, and then we'll start the webinar shortly. All right, I want to thank everyone for joining us today. My name is Lindsey McKay, and I'm owner and lead advisor at McKay Wealth Management. Today, we're going to be learning a little bit more about Medicare. For those of you who have already enrolled in Medicare, I think there's going to be some key takeaways about changes that might be impacting you. And then for those of you that have not enrolled, we're going to learn a lot about timing of when to enroll and consideration. So something for everyone on this webinar today. We're going to do our best to cover as much of your questions as possible. So we're going to wait and save the questions until the end, but I encourage you to ask them as they come up. You can do that in the question and answer box that's located in the lower middle of your screen. And again, we'll hopefully answer them as we go, but at the end, we are going to save some time to address any questions that have not been covered in the material. Additionally, Medicare is going to be very unique to each and every one of you. So there might be some questions that you have that's specific to your circumstances. You can always reach out to our office to help get clarity, or as you're going to find out in a moment, Bob will be available to assist people if they don't have a Medicare specialist that they're working with. So with that, I'm going to go ahead and introduce Bob Mitzel. He's joining us today to help educate us on the process of enrolling in Medicare. He's very experienced in the space, knows all the ins and outs, which is saying a lot considering it is a convoluted and it's sometimes complicated process. So with that, I'm going to turn it over to Bob for him to share some of his knowledge and experiences that he's seen over the years, and also what's anticipated for some upcoming changes for Medicare. Bob?
Lindsay, we're going to go ahead and move to the next slide here. Good afternoon, everyone. Again, this is Bob Mitzel, and I am the principal and senior account advisor for Robert Mitzel Insurance. And just a little bit of background, this is going to be my 15th year of working with people with Medicare. And currently we have about 9 independent agents that work in the Western US states right now. And we take care of approximately 3,000 clients as of right now. So a lot of changes coming up for this next year, but we wanted to start with getting people to understand how to prepare for Medicare. So there's growing trends in Medicare, and I want to take some of this information, or take this information that we're going over here with. I want you to think about the numbers of people as we walk through this presentation. The fact that there are 11,000 Americans that are Medicare age each day, 11,000 every single day. And there's currently 67 million people on Medicare. And if there's 350 million people in them in the US right now, that's 19% of the population is on Medicare right now. And they're predicting 80 million by 2030. And that would be about 23% of the population on Medicare. So those numbers are important to think about as we walk through the information we're going to go through. So when you're getting ready to possibly go on Medicare, there's questions you want to ask yourself at age 64 and a half. Do I want to go on Medicare at 65? Can I keep working and stay on my employer health plan? I'm working and on my spouse's employer plan. Can I stay on that plan? And if I'm not working, can I stay on my spouse's employer health plan? I run into these questions every day with people, and it's not the same answer for everybody. So we want to walk you through and see if we can answer those questions for you today. So let's say that we say, yes, I do want to go on Medicare at 65. Then what do? Medicare will start always on the first day of the month of your 65th birthday. So, for example, if your birthday is December 15th, then you're able to go on Medicare as of December 1st. But if your birthday is on December 1st, you're able to go on Medicare as of November 1st. So that's the soonest you can go on Medicare. You have 3 months before to sign up, and then you can be under your initial enrollment period the 65th month or the 2 months after that under your initial enrollment period. Now, there's different ways of getting your Medicare. The first way that most people do is they go online and you have a Social Security login, and you go into your Social Security login about 3 months before your 65th birthday, and you will log in and sign up and do the application for Medicare Part A and Part B, effective the first day of your 65th month birthday. You want to make sure if you do it that way that you get a confirmation number at the end of that process. And then if everything was done correctly, you'll get an email from Social Security about 24 hours later saying that they received your application and they're moving forward with it. Another way for you to get your Medicare is you visit a Social Security office. Now, there's going to be different experiences when you go to a Social Security office, and I've heard them all. For instance, one time or many Social Security offices, you'll go there and there'll be long lines. You'll have to wait all day to finally see someone to get the job done. There's other offices you'll go to and they'll say, we're not accepting any walk-ins anymore. You have to call this number to set an appointment, and the appointment is 6 weeks out. And then if you go down the road and to a different county and go to a different Social Security office, they welcome you, give you coffee, ask you to sit down, and they take care of you right away. So you never know what experience you're going to have when you visit a Social Security office. It seems to be a little more welcoming if you want to go to a more rural Social Security office than the urban ones. The urban ones are very, very busy. So, two methods: go online, get your Social Security done online through your website, through your login, or actually go to an office. Now, once you've done that, you have 4 to 5 weeks to wait for your card to show up in the mail. Now, if you have not received your Medicare card or any correspondence from the Social Security office within 4 to 5 weeks, you want to call Social Security immediately and find out where your application is. Because if there's any I's not dotted or T's not crossed, they simply don't do anything, nothing moves. So you want to check and see where your application is, see if there's any hurdles, and get those fixed. So always wait about 3 or 4 weeks. Nothing comes, definitely check with them to see where everything's at. Okay, I plan to keep working past age 65. Can I stay on my employer's plan? Yes, you can. If your employer has more than 20 employees and has a comprehensive insurance and prescription plan, you can stay with your employer plan beyond 65, no penalties, no issues. The one thing you want to do is you do probably want, and this is not, you don't have to do it, but it's best for you to go ahead and go to the Social Security office or go online and apply for your Part A only, not your Part B, your Part A only, because that comes to you at no charge and it can become a secondary insurance for hospitalization to your employer plan if you need it or go to the hospital. So it could help out on your deductible and copay from your employer plan by getting the government and that Medicare to subsidize that. So I always suggest you get your Part A and have it with your employer plan. Now, if your employer has less than 20 employees, you need to go to Medicare because that's not going to be a plan that they're going to recognize. And there will be issues down the road of you trying to get on Medicare. So definitely, if you are 21 and more employees, comprehensive plan with coverage, you're good to go. But less than 20 or self-employed, you definitely want to go to Medicare. No questions asked. Okay. 3 months before you're ready to retire, let's say that you're on your employer plan to age 70 and you want to retire, let's say October 31st. Then what you need to do is go to your HR department and you want to get a form filled out by your HR department, and it's called a CMS L564 government form. And you want to do this about 3 months before you retire. And what they do is they'll fill that out and sign it. And what it is a form that proves to the government that you have had comprehensive medical coverage and prescription coverage since you turned 65. So you need that form as proof that you've had coverage. Then with that form, you're going to either go again online to the Social Security website and apply for your Medicare Part B because you've already got Part A. You did that when you were 65. Or you want to go to the Social Security office and apply for your Part B. So little things to know about is if you're going to retire October 31st and your employer coverage is going to end on October 31st, you want to start your Medicare on November 1st. But say you're going to work until November 5th and then retire, there's a very good chance that your employer is paying for your health insurance through the end of November. In that case, you would start your Medicare Part B on December 1st. So there's some little timing things there that you want to work out to make sure that you're not paying for Part B when you still have your employer plan, or maybe going a month without Medicare and having any insurance. So you want to make sure you time that correctly. Okay. I'm not working, but I plan to stay on my spouse's employer health plan. What should I do before turning 65? Again, the same rules. If your spouse's employer is again 20 employees or more and it's a comprehensive plan, then you can stay on that plan and not go to Medicare. But you want to get with your Medicare advisor and you want to review some things because maybe that's not the right decision to make. So, first, we want to do is we want to check with your spouse and find out is he or she going to be retiring 6 months from when you turn 65 or 6 years later? What is the cost for you to be on your spouse's plan coming out of his or her paycheck? Is it costing your spouse $60 a month for you to be on that plan? Or is it $600 per month for you to be on that plan? What is the employer plan deductible and maximum out of pocket? So maybe that plan that you're currently on has a $1,000 deductible, or it might have a $5,000 deductible. What is the maximum out of pocket? So we want to look at those things because if you come to me as an advisor and say, my spouse is not going to retire for 6 months, the cost of my plan is only $60 a month, it's only $1,000 deductible, maybe $2,500 maximum out of pocket. then I'm going to probably say you can stay right there. It's a good idea. Just stay where you're at. If you like the plan, it works for you, and there's no reason for you to move right now. Just stay on the plan. And then when your spouse is ready to retire, you guys can go to Medicare together. But many times I'll find out that the spouse is going to retire, say, in 3 months. So you're going to be going to Medicare anyway in 3 more months. Maybe the cost is $600 coming out of your spouse's paycheck for you to be on that plan, or your deductible is $5,000 and your maximum is $8,500. Then we probably want to put you on Medicare right away. We don't want you on that employer plan anymore because we're going to be able to put you on a Medicare plan that is much better than that plan. It's going to be financially better and it's going to have better coverage. So you just got to look at that and figure all that out. It's surprising when I ask clients the question, how much is it costing for you to be on your spouse's plan? Usually they don't know. And so it's something that you want to look into and find out what that cost is. So if we do all that and your spouse, you decide to stay on that plan, that spouse's plan that has been working out really well for you, still you want to go and get your Medicare Part A. So you have that with your spouse's plan, and that way that can be a secondary to your employer insurance. A lot of detail there, but it's all important for you to work that out. Okay, now we're going to get complicated. And this is information not just for people that are going to be new to Medicare, but for the people that are existing clients on Medicare. So this might be a little review for them, but we want to show you exactly how Medicare works. And I start out with explaining exactly what kind of health insurance you would have if you just had Medicare by itself. So let's start with that on top. If you just have that government Medicare card, nothing else with it, you have Part A. And Part A does not cost you anything as it's paid for by the Medicare payroll taxes you're paying on your payroll. So once you retire, you won't be paying for that anymore. And Part A is strictly the hospital building, the hospital bed, the rehab center building, and the rehab center bed. Nothing else. Building and bed. And if you have Medicare by itself and you get admitted into the hospital or rehab center, you would have to pay for 2024 $1,632 deductible to get through the front door. That's with Medicare by itself. And as you can see, if you come back 2 months later, you would have to pay it again because it's a 60-day deductible. Now, Part B, you do pay for it. And the standard rate is $174.70 per month, and that's for 2024. Now, that rate is based on your income. So Medicare looks at your tax returns every November, and they determine what your Part B rate is. So if you filed jointly and you made less than $200,000 in a year that they're looking at, which right now, if I signed up someone to Medicare, they'd be looking at your 2022 tax return, then you would be paying 174.70. If you made more than that, $200,000 filing jointly, then there's a scale that works its way up. And the more money you made that year, the more your Part B is going to cost you. So you need to know that's on a scale. Now, on the opposite side of that, if you have limited income subsidy program with the government, or you are on Medicaid and you don't make very much money, you can get a zero premium for your Part B. They can waive it completely and you won't have to pay for Part B. So most people are in the middle, they're paying the 174.70, but higher income people are going to pay more. Real low income people might not pay anything. So, what is Part B? Part B is everything else that they can do medically except for prescription drugs you take home to take. So, doctors, surgeries, CAT scans, labs, MRIs, emergency room, everything that's done to you. And if Medicare, if you're on just traditional Medicare, Medicare will pay 80% of that bill, and you're responsible for 20% of that bill. Now, the problem is the 20% because it has no ceiling or cap. So if you have a $100,000 bill and you're on straight Medicare only, you're on the hook for 20 grand in that situation. So we never recommend that anyone stay on Medicare by itself. Now, saying that, there are millions of Americans that are on Medicare by themselves, and either they don't know any better or they have nothing to lose. I'm not sure why, but we would never recommend that you do that. So you have two options. The two options are option one is what about 20% of the people around here do? And that is they purchase a Medigap or Medicare supplement plan. And those are sold by private insurance companies, and they're universally identified by the alphabet. So you have plans A, B, C, K, L, N, and the most prominent plan is Plan G. So you can buy a Plan G from AARP, you can buy a Plan G from Humana, you can buy a Plan G from anywhere. A Plan G is exactly the same from any company that you purchase it from. The only difference is the customer service level at that company and the price for that Plan G. So let's tell you what a Plan G does. If you go to a doctor, hospital, or clinic, they will bill traditional Medicare. And what Medicare does not pay and what you have to pay, that Part A deductible, $1,632, and the Part B 20% you have to pay, both of those are picked up for you by Plan G. So the only doctor bill you're going to have when you're on Medicare and a Plan G is the first $240 expense to a doctor's office at the beginning of the year. And after that, all medical expenses are paid in full. Also, with traditional Medicare and supplement plan, you can go to any doctor that accepts, or any hospital, any facility that accepts Medicare nationwide. There's no networks. Go wherever Medicare is accepted. Now, just so you can have a little bit of arithmetic to add to your notes, a good Plan G priced around here is $230. So a Plan G is $230 a month. And if partners or spouses are on the plan with you, you get a discount down to $215. So just to get a rough idea of what that costs you. Then by law, you have to have a prescription plan. And the prescription plans are going to be priced anywhere from $30 to $130 and everything in between. And it's going to depend on what prescriptions you take. So your Medicare advisor will look at all your prescriptions and they'll figure out what plan would be best for you in a premium and in copays and in formulary of what drugs they take care of you on. But just an average run is going to be around $35. So just to summarize option one and give you a little math, if you pay $230 a month times 12 months, and you pay about $35 a month for your prescription plan times 12 months, you add in the Part B deductible of $240 that you will pay at the beginning of the year, then you're looking at about $3,420 per year, or about $285 on average per month. And all your medical costs are paid for in full. You still would have copays for prescriptions, and you still have to keep paying the 174.70 to the government for your Part B. And let me go back to that 174.70. If you're on Social Security, that would come out of your Social Security check every month. If you're not taking Social Security, the government will bill you quarterly for that dollar amount. So that's how the government gets paid. It comes out of your Social Security every month, or the government will bill you quarterly for that amount so they can get paid, and you'll have to pay them direct. Okay, option two, which is what about 80% of the people do around here, and that's called a Medicare Advantage plan. Medicare Advantage plans work this way. You go to Medicare and you say, I want to be on a Medicare Advantage plan. Medicare says, no problem. Medicare will give the full responsibility of your health care to the Medicare Advantage plan you decide to go with. And then Medicare pays that plan right around $10,000 per year. There's some variables there. We'll go into those later, but right around $10,000 per year. Now you have a Medicare Advantage plan that includes most of the time your prescription plan. And then they also give you many times auxiliary benefits like dental and vision and activities budget and gym memberships and over the counter budgets. And they give you all kinds of extras that you do not get with traditional Medicare or the supplement side. You will usually pay very little for your Advantage plan. Most of them are zero premium. You pay nothing per month to be on that plan. Some are like $25, $35, $55, but most of them, a majority of them are going to be a zero premium plan. And they can be zero because they're getting that 10,000 from Medicare each year that you're on that plan. So it depends on which county you're in, on which Medicare Advantage plan you can go on. So let me give you an example. If next year for 2025 in Grays Harbor County, there's only going to be one Medicare Advantage plan out there, only one. So either you're going to be on that one plan or you're going to be on option one and doing a supplement plan with the prescription plan. There are no other options. If you lived in Whatcom County up in by Bellingham, there's 9 plans up there. If you're in Kittitas County, there are 9 plans. If you're in King County, there was 65 Medicare Advantage plans in King County. So a lot to choose from. You want to get with a good Medicare advisor because they know what the best plans are, of course, in their opinion, for each county. So otherwise, you would not know where to go, but they'll give you the top 2 or 3 or 4 plans based on uh, their copays, based on their benefits, based on a lot of different things you want to think about when you're choosing a Medicare Advantage plan. Most of the Medicare Advantage plans, you pay copays as you go with a maximum out of pocket of between $4,200 and $6,900 per year. Now, saying that, less than 1% of the people that are on these plans ever reach that number. So, just to give you a couple of examples without going into specific plans, most of the time you can see your primary care doctor at no charge. A specialist visit might be $30. If you go to the hospital, a lot of times the copay would be like $390 per day, up to 5 days, zero after that. And the 390 includes everything they do to you in the hospital. So, two examples. If you go to the hospital Monday morning, have knee replacement Monday afternoon, spend the night, go home the next day, that'll whole thing cost you $390 copay. Or example two, let's say you're in the hospital for 3 weeks with 3 surgeries, all kinds of complications, and you run up a $500,000 bill. Then your copay at $390 per day up to 5 days, you're going to pay a little less than $2,000 out of pocket for that visit on a Medicare Advantage plan with those copays. So it just depends on what plan you're on and how it works for you and which one you want to choose. Now, one more thing I want to talk about before we switch to the next slide. When you go to the supplement side, option one, and you do that at the beginning of Medicare. Let's say you do that when you're aging in at 65 or you're going to full Medicare at 70, you're guaranteed issue into option one supplement plan. No questions asked. You're in, sign up, go. Same thing on option two. There's no questions asked. You go right into a Medicare Advantage plan. But if you're on an Advantage plan for more than 1 year, and now you want to go back to a supplement plan, you got to go through underwriting. And so you want to watch that and decide, okay, in the beginning, do I want to go to a supplement plan and pay all those premiums and know I'm in a great place, but it's costing you per month, per year, guaranteed issue, no issues. Do I want to go to the Advantage plan? And you have a trial period during your Advantage plan first year that anytime you want to leave the Advantage plan during that first year, you can go to the supplement plan, guaranteed issue, no questions asked. But again, after year one is complete, you will have to go through underwriting to get to the supplement plan. So it's things we want to talk about. Um, and there's a lot to that because you're talking about say a husband and wife, it might cost them $6,500 a year in premium to be over on option one, yet they don't have any doctor bills, or it costs them nothing for premium on the Medicare Advantage plan, but they pay copays as they go. So it's kind of, where do you want to be? Do you want to pay up front or do you want to pay as you go? And everyone's going to be a little different on that. Okay, a lot of information there. Let's go to the next slide. Okay. There's a lot of changes going on in Medicare, especially for next year. I've been told that by many of the insurance carriers that there might be as many as 70% of people that are on prescription standalone plans or Medicare Advantage plans making plan changes this coming open enrollment. So let's start with what open enrollment's all about. Every year between October 15th and December 7th is annual enrollment, and that is where you can make changes. You can go from a supplement plan to an Advantage plan. You can go from one Advantage plan to a different Advantage plan. You can move around. You can you can go from one prescription plan to a different prescription plan. So a lot of changes are going to make people want to make those changes during this open enrollment period each year. Now, what we do as our agency is we actually will send a letter to everybody, and it arrives around October 1st. And it will basically tell everyone what we're seeing happening with Medicare, both on a national basis and a local basis. And then we'll also give you a memo, and the memo is going to be what we recommend based on the plan you're currently on. So we might say, you're on a great plan. Here's why we see it as a great plan. And we recommend you not change for next year. And here's why. Or you might get a memo that says, your plan is doing this, it's doing that, it's doing this. We have issues here, issues there. We recommend we do a review and do a plan change. And then when we get together, we'll go into the detail and we'll do a plan change if that's what we decide to do. Now, if you don't do anything at all, then you will be automatically renewed on the plan you're currently on. So it's a chance for you to do a review and do a plan change for that 2.5 month period there. So let's get into the industry trends. Let's start there on that left-hand side. There's a lot of things changing next year. And what's happening is especially with the Medicare Advantage plans, is as the population is getting older, Medicare would reimburse the Medicare Advantage plans with additional percentage of money each year because the population's getting older. As they're getting older, there's more hip replacements and more shoulder replacements, more knee replacements. There's more claims. So Medicare would reimburse the carriers a little more each year to take care for that population getting older. Well, this year, as I understand it, the reimbursement is not as much as the carriers really need based on claims. There's also some new high cost drugs that are entering the market that are absolutely fantastic, but very expensive. We've got some changes in the star rating on how they look at it. And what the star rating is it is the way for CMS Medicare will rate each Advantage plan and prescription plan and give them a rating based on a number of different components. And so the higher your rating, the more reimbursement they get for their plans. So there's been some changes there that make it a little harder to get a higher rating. And then we have the Inflation Reduction Act from 2022 that mandated, first in 2023, that anyone that is on insulin only needs to pay $35 a month for their insulin. And so that was taken care of by all the Medicare Advantage plans and the prescription plans. Last year, all of your vaccines, all the major vaccines are zero copay. So you didn't have to pay any copays when you went to the pharmacy for a lot of the vaccines, where years past you did have to pay the copay. And here's the big one for next year. Congress and the administration mandated that nobody spend more than $2,000 per year out of pocket for their prescriptions. Now, that was affecting about 20% of the people on Medicare. So 20% of the people on Medicare were paying more than $2,000 a year. Some 3, 4, 5, 6. They were getting into the donut hole 3, 4, 5 months into the year and having to pay 25% of the cost of their drugs. So they were paying way beyond $2,000. Next year, it's capped at 2. So those people are very happy. Let me back into just real quick 3 scenarios so you understand how this affects people. for people that are especially currently on Medicare. Again, it affects 20% of the people. So if you're in group one and you weren't taking any drugs at all or taking generics, you're probably not going to be seeing much difference in your prescription side of your plan. If you're in group two and you were spending that $2,000 or more than $2,000 a year and you're capped at two, you're extremely happy because you just saved a lot of money for next year. And they're putting a payment plan together. So say you're spending $2,000 a year now capped, you were paying five or six, you can put that on a payment plan with your insurance company and pay the same amount each month, $166.67 a month to get to your 2000 to make it easy for you to budget. But group three, that's someone that maybe takes only one tier one expensive drug. I'm sorry, a tier three drug. And they maybe were paying this year $500 to $1,000, $500 to $1,000 per month or per year for their prescription. If they're on the wrong plan, they could be paying $1,500 to $2,000 next year. So it's going to affect that group three that are taking one tier three drug. And those are the people that might need to change their plans just because of that one reason. So you're getting into the woods here a little bit on details, but I just wanted you to know about that because it's going to affect a lot of people. So you have all these industry trends, and now it's impacting the Medicare Advantage plans and the prescription plans. So basically what we're seeing is the reduction of benefits and higher cost sharing on Medicare, on many of the Medicare Advantage plans, because like I said, they weren't being funded. So now they have to figure out how to spread that cost. And that's by raising the copays to a higher level or reducing benefits. There's also some premium increases, and there's also reduction of plans offered. So sometimes a carrier would have six Medicare Advantage plans, and maybe they're dropping it to only two because they can't afford to have six anymore. And a real big one is a lot of Medicare Advantage plans are leaving counties. And I'm having that issue right now. There is a carrier that's leaving five counties. And that means all those people that were on those plans have to find another plan. And there's in the counties we're talking about, there's not a lot of options. There's another very, very large carrier that had over 34,000 Medicare Advantage plans in Western Washington. And they are putting up the white flag and saying, we're done. We're not doing Medicare Advantage anymore. So 34,000 people are getting letters this month that say, we're no longer be doing Medicare Advantage anymore. If you want to stay with us and do the supplement plan, you can. Otherwise, you'll have to go to a different Medicare Advantage plan with a different carrier. So a lot of turmoil going on in the industry right now. And it's important for you to kind of know where you're at. If you're currently on Medicare, maybe get with your advisor in October, do a review, and make sure you're on the right plan for you going into 2025. And as for the people that are new to Medicare, you're good. You're just going to go through the processes like I just showed you of getting on Medicare and then get with a good advisor to help you through the process. So we have a summary here. I know I threw a lot at you. You want to make sure you review your Medicare plan options with your Medicare advisor. Confirm you can continue to see the providers under your existing plan. Review your prescriptions, determine your copays, deductibles, review the plan auxiliary benefits, how to utilize them. So many people have benefits they don't utilize. And then if you're new, you want to complete the enrollment application and confirm enrollment. So a lot of things for you to do right there. I also want to step back. You can read all these things, but I want to step back and say there are a lot of company sponsored supplement and advantage plans, like Boeing has a very, very good sponsored Medicare plan for their retirees. The Washington State School District system, the PEB plans, have various options that are for people that are ability for you to go on those. Many of those options are very, very good, and you want to get with your PEB people, decide which ones are best. So not just do you have options for you to go on plans like I described, you have sometimes company, union, or government sponsored Medicare plans that you can go on that are very, very good. So you want to definitely review those. Lindsay, I think that's everything. I'm sure that we have 90 questions that have come in.
Thanks, Bob. It's always a good start of just covering some, reminders for a lot of people. And then we did have, quite a few people that are already enrolled in Medicare that were waiting to get more information about the changes that are coming. I think one question would be, how often do individuals that are already enrolled in Medicare, how often should they be revisiting their existing plan?
Well, most of the time, like I say, I will send out that review, that letter in October, and I will let them know if the plan they're on is going to be a good plan for next year. And a lot of people will take my advice on that. But if the plan is not working for you, it's just not. You definitely want to look at doing a review in October and doing that change. Saying that, I've got people that I put on plans 10 years ago and they still haven't changed. And it's because it works for them. And if it's not broken, they're not going to fix it. They get my information. They know that there might be something out there that has more value than what they're currently on, but they're happy with what they have. It works for them and they're good to go. So this year, I would suggest maybe you do a little bit deeper review because of all the changes. But like I say, most of the time, you don't have to change every year, but you definitely want to look at it, at least review it as the changes come to you each year in September and decide if you want to stay on that plan or not. It's up to you. It's a puzzle. Medicare is a puzzle, and every puzzle is different for everybody. And it's just important that you sit down and put the puzzle together and know what your options are and do what's best for you.
Yeah, and I'll just add that how fantastic is it that there is the option to make changes. A lot of times we're restricted in what's available to us. So if you have not reviewed your Medicare plan recently, it might be a good opportunity to just revisit what's out there and make sure, as Bob said, you've got a plan that is best suited for how you're using your coverage. We did have a couple of questions around this, the employer size. So if you are less than 20 employees, or if it varies, so some companies have seasonal workers or things where sometimes they're above, sometimes they're below. Can you revisit a little bit the importance of being, continuing coverage on a plan that exceeds a certain number of employees?
As I understand it, you have to have at least 20 employees all the time and have a comprehensive medical and prescription coverage. And if you think your company is dropping below 20, I would not plan on staying on that plan. After age 65, I would definitely go to Medicare. Because if, say, you stay with that plan for 3 years and then you want to go to Medicare, and the government reviews your CMS L564 and determines that you did not have comprehensive coverage with an employer with higher than 20 plans, then you could be paying a pretty substantial penalty every month. And so you don't even want to go down that road. So if it's close, you don't want to do that. You just don't.
And unfortunately, there's no way to verify that until you go to actually apply and they look back.
Yeah, I mean, you know how many employees, you go to your HR person or whoever's in charge, and you know how many employees are there and if they're comprehensive coverage. Your HR person should know that, even even with a employer of 20 or less employees. But if you have someone that's got 820 and then it bumps to 22, then it bumps down to 18, I personally wouldn't mess with that. I would go to Medicare.
Thanks for the additional
Now, if there's
clarification.
50, if there are 50 employees and it drops to 40 and goes to 80, that I don't have a problem with that. But for if you're right around that number, I just wouldn't trust it. Just my opinion.
And so if there's anyone on the call listening that falls into that category where they weren't aware of this mandate, your recommendation would be that they apply for Medicare coverage now?
Yes, I would go get that CMS L564 form and go have a conversation with the whoever's in charge of HR for that company, and then move to Medicare. Yes.
Thank you. Question about Medicare Advantage plans, and do they have a lifetime maximum?
No, lifetime maximum. They have an annual maximum. So the annual maximum is anywhere, I've seen them as low as $4,200 per year, seen as high as $6,900 per year, but they're usually in that range. And that is what that means is you will not pay any additional copay beyond the maximum out of pocket for that plan for that year, but no annual, no.
And then for the Medicare Advantage plans, can they terminate your coverage?
No, they can terminate the plan, but they can't terminate your coverage. No. So if they terminate the plan, which, like I said, they did this year, a lot of plans, then they give you that notice in September. And then you have that October, November, and early December open enrollment period to find another plan for the next year. They will never terminate it in the middle of the year. They'll do it at the end of the year. So you have time to change.
At the beginning of the meeting, you said that there's the option to apply online versus going in person. Do you have a recommendation or, from personal experience, you can share what you would recommend people, what path you'd
Oh,
recommend people taking?
great question. I'm telling you, it's all over the board. I've had some people that just have no problem. They just go online, they do it, they got their card in 2 weeks. And it just everything was done correctly. And then I have some people that maybe forgot to click something or forgot to do something and they didn't get their confirmation number and it didn't go through. So if you're really confident about going into government websites and applying and being real detail about how you do it and getting that confirmation number, then that's fine. You can, a lot of people can do that. If you don't feel comfortable doing that, then find a rural office to go to and have somebody help you.
And I'll just echo, making sure that you have access to your ssa.gov login ahead of when you'll need it. We've definitely had clients that for various reasons have had trouble accessing that portal, and it, can be very frustrating when you're ready to apply for Social Security benefits or Medicare. And then at that point, have issues accessing your account. So if you have not already set up that online access, I would encourage you to do that at this time.
Yeah,
But
and really remember your password because that's really messed up when you don't. It's really hard to change passwords and doing some of those things with them because there's so many security things going on, as you can imagine, on sites like that. So they're very careful, and you have to be very exact on how you set it up with the exact usernames and exact passwords.
Yes, the joys of technology. Well, with that, I will go ahead and just reiterate that there are some, I guess, complexities to navigate in this space, and so if you're either revisiting your coverage or getting ready to apply for the first time and have any questions, please reach out to us so that we can provide guidance from our role. And then if you don't have a Medicare specialist that you're working with, Bob is available to meet with you, as well as we have other individuals that are licensed in different states depending on where you reside. I think that was one of the things that it surprises people sometimes, is that it does vary from state to state, or as Bob referenced, county to county. So it does become extremely important to work with someone who is local in the area that you are living in and looking to get coverage. So, Bob, any final comments or things that you would like to wrap up with before we let everyone go?
And I will add to that, Lindsay, by I'm licensed in 12 states. And so when people are in Western Washington, say they moved to Arizona, what I'll do is I'll take care of their move. So they'll move down there and then we'll get them on a good plan down there. But then after I do that, I always recommend that they find a really good advisor in their local market to take it beyond what I did for them. And so maybe the following AEP, they can get with someone to look at it because I know this market very well. I know the state of Washington really well. But when we get into some back canyon town in Arizona, I generally know what's going on down there, but I don't really have as much of a feel like I would if you lived in Redmond. So I always advise people, I'll take care of you to get there, but once you get there, I want you to find someone like me to take care of it from then on.
Great. Well, Bob, I want to thank you for the time today. Really appreciate your
Yeah,
insight and sharing the tips on things that people should know as they're preparing to apply for Medicare, but also some of the upcoming changes. And, just like so many other things in our life, I think these often feel daunting as we're anticipating it. And then when we get to the moment itself, leaning on others to help provide guidance and expertise makes it a lot easier than we thought it might be. So, we'll just reiterate what Bob said: working with a professional in the area that you're at who knows it locally is key, and they can make that process a lot simpler for you. Um, and so with that, we'll let everyone go for this afternoon. Thank you for joining. And if you have any additional questions or follow up, please let me know. And Bob, I just want to let you know there's a lot of thank yous coming in the comments. So we'll once again say thank you for your time, and we'll look
thank
forward
you for
to hearing.
allowing me to do this today. Thank you, everyone. Have a great afternoon, and we'll talk to you someday, maybe. Take care.
All right. Bye, everyone.